Well, a new study has shown that 4 in 5 or 79% of employees in Nigeria are at increased risk of developing mental health issues. This came to light as Nigeria joined in marking World Mental Health Day. And Arise News correspondent Benny Ack reports that the focus in Nigeria was mental health and well-being in the workplace.
The study by WellKnowMe, a health technology company, found that 8% of Nigerian employees have an increased risk for developing depression. This, according to the World Health Organization, makes Nigeria the country with the highest caseload of depression in Africa. It found that negative working environment may lead to physical and mental health problems, harmful use of substances or alcohol, absenteeism, and lost productivity.
If you look at two categories of people, there are those that already have a mental illness and are in our workplaces. The question is, what kind of support are they getting? Are we stigmatizing them? Are we giving them the space for them to feel comfortable to speak out and share what is happening to them so that they get the support they need?
Many of us sort of shy away from issues of mental health, but this is not something we can run away from. The fact that you don't acknowledge something doesn't mean that it does not exist. So it's even better to grab the bull by the horn and deal with the issues. We need to take away the stigma that is associated with this so that people that are challenged can come forward to get the help that they need.
From the workplace, the rising cases of mental health issues in Nigeria have been linked to factors such as poor economic conditions, rising cases of illiteracy, marriage crisis, polygamy, and large families. A major issue is that 85% of people who live with the condition have no access to treatment. According to the Association of Psychiatrists in Nigeria, there are fewer than 300 psychiatrists for an estimated population of 200 million people. In addition, psychiatrists and other mental health specialists are mainly available at tertiary healthcare centers. At the Yaba Hospital in Lagos, each doctor now attends to 50 to 80 patients per day.
We all have some form of mental issue. Some of us get angry unnecessarily. We are pissed off by little things. We get frustrated. We shout at our maybe workers. And when we talk about the workplace, we don't necessarily mean big conglomerates, big offices, and the rest. Even the home is a workplace where you have your drivers, your maids, your cooks. It's a workplace. So there's this need for us to bring to light, to bring to focus and sensitize the general public what mental well-being is all about.
A mental health bill, first presented to the National Assembly in 2003, has now been reintroduced by the National Policy for Mental Health Services Delivery. It sets out the principles for the delivery of care to people with mental, neurological, and substance abuse problems.
Advocates, psychiatrists, stakeholders are asking for our Mental Health Act. Last legislative period, it got to second reading, ended. Now they've done a second reading, and it's really about getting this bill to the office of the president. No one is championing it at the moment. Why? Why should a country like ours still be in this state? The framework, the legal framework that we are using for provision of mental health services is probably well over 60, 70 years old.
For now, experts say there is an urgent need for more investment on research and development, as well as an information center on current trends, areas of need, and unmet needs on mental health services. This, they say, will help in making informed decisions on policy directions and identify appropriate interventions. Benny Ack, Arise News.
Joining us now for more on this crucial topic, Dr. Zainab Mohammed, clinic lead at Reconnect Health Development Initiative, and Chime Asonye, who is the founder of Nigerian Mental Health and is trying to push a mental health bill through the National Assembly. Thank you both for joining us on the news tonight. Let me begin with you, Dr. Mohammed. The theme for this year globally was make mental health for all a global priority. However, like we heard in that report, our correspondent and colleague said Nigeria is focusing on the workplace this year. Do you want to tell us why that is so? Are we having more toxic workplaces? And how bad is it?
Well, to start with, if the mental health of the staff is not at an optimal, productivity will be at an optimal low. And that is something as employers and employees we really need to put in focus, push out. If you're stressed, you come into work, your boss is pushing you with so much workload, he's not caring about whether you have timelines, unrealistic timelines. A lot of the time it's
dangerous.
It is.
Yeah.
Because maybe there's an issue at home you're probably dealing with, and you come to work, you don't unburden your home issues. You come to the office, you still have time to, you have stress, anxiety, panic disorders, depression, drug abuse. A lot of the times that if organizations don't have a drug policy, a lot of the people go into drugs, and that's actually a problem.
It's quite sobering. I mean, to think that if I counted the number of us here in the studio, we're about 5, 6 right here in the studio. One of us has mental health. No, actually 4 out of 5. That's what the report says.
That's really number.
That's very overwhelming. But we'll come back to the issue of the workplace, and mental health. But Dr. Chime Asonya, I mean, you're the founder of Mental Health, Nigeria Mental Health, and you're pushing this bill. What exactly does this bill seek to address in, changing the narrative as far as mental health policy is concerned in Nigeria? What are the key elements?
Yes, thank you for inviting me. As you said, I'm the founder of Nigeria Mental Health, and just this past weekend we had an awareness walk where we pushed for the bill. Over 30 organizations have signed on to for the President, the National Assembly to adopt the National Mental Health Bill 2020, and I think that there's a lot of reasons for why that's key. Our national mental health framework is colonial. It has roots that date back in 1916, and it was codified into a law in 1958, which predates independence. And there's really 4 key tenets that the National Mental Health Bill would change. The first one has to do with human institutional services. So it will establish things like a mental health assessment committee made up of psychiatrists, lawyers, traditional rulers, social workers that will help protect those with human rights who are psychologically vulnerable and protect them. And it will also establish a mental health fund, because we can't talk about policy change if you cannot finance it. The second thing it will do is protect human rights. It will prevent discrimination of those who have mental health conditions in things like housing, in things like medical services, in things like employment. It will also guarantee them the right to privacy, the right to make sure they have a voice in their care. The third thing it will help is in the context of management. It will help de-risk issues as they escalate for individuals. It will also create things like the National Department of Mental Health Services, which will establish national guidelines across the country that the private sector and public sector is supposed to account. And then the final thing is going to help with care. This is really key, because when you talk about mental health, it's not just an Aso Rock, it's in the communities, because we all have mental health, we all have mental well-being. So we need to make sure that mental health gets to the primary healthcare centers and the community. This bill will help ensure that it's mainstreamed in primary healthcare centers, so those mental health and critical mental health services reach those at the last mile.
All right, Dr. Sonia, let me stay with you and find out how your bill is different from the bill currently in the National Assembly that has passed second reading at the Senate. How is it different, and why are we having multiple bills?
My audio's come out.
Okay, we do apologize for that. Perhaps let me stay with Dr. Mohammed. We'll try to fix Dr. Asonya's connection. Dr. Mohammed, you highlighted some challenges, some precursors or factors that could lead to ill health when it comes to mental health. What is the level of awareness in Nigeria when you talk about mental health? Because a lot of people just, stigmatization. A lot of people say, you're mad. And that's derogatory for a lot of people.
Yes.
But when you look at the numbers, like Ngozi said, 4 out of 5 people do have mental ill health. So it's a serious challenge, but why do we always think if you're not roaming the streets with tattered clothes, then you seem to be okay? What's the level of awareness?
Level of awareness, I think with COVID, that kind of brought to light mental illness and mental health issues and kind of opened up the conversation, because prior to that, a lot of people would think mental health, oh, you need to speak to a psychiatrist or psychologist. I'm not mad. That's the first reaction you get. Or you have someone who's having schizophrenia, bipolar disorder. You know, we're a secular country. First thing we say is the person's not religious, it's not my portion, it's my village people. But now I think a lot of people, especially with COVID, there's organizations that have come up. There's many NGOs doing awareness, free advocacy campaigns. Like my organization, we aim to raise awareness and increase access to affordable mental health care. Because seen as is not part of the national health insurance scheme, it is quite expensive, private mental health care. So that is one of the things that we try to do. We have programs for school kids, because teachers and guidance counselors, we need to be able to identify. Even kids go through trauma. They have depressive episodes, they have anxiety, PTSD, autism, developmental disorders. So we have programs that we do to educate people on different kinds of mental illnesses in an interesting way. We have a series called the Don't Judge series. You know, you see someone well put together, probably she puts on her makeup, comes to work 8 o'clock in the morning, not knowing she's probably hiding bruises, probably domestic violence, but you don't know. Especially with COVID, the increase in domestic violence rate, it went up really high. So I think we're trying. There's quite a few organizations coming up. We have a toll-free line that we've set up in partnership with NDLEA that is strictly confidential. You can call in 24/7. We have psychologists trained.
You want to give us that number?
Now,
Yes, I will give you
ahead.
a number.
yes, okay, while we're waiting for that number, let's bring in Dr. Asonya. Thankfully, we're able to reconnect with you and have this conversation. Yes, it's one thing to talk about, public awareness, that, awareness seems to be on the rise on the issue of mental health. But how do you manage it? I mean, what are the signs that you even look out for in the first place? I could come to work all smiling, well-dressed and all of that, and something may be wrong. What do you look out for? Because every now and again, you hear people, who maybe they're friends to someone who's committed suicide, and they tell you how shocked and how surprised they are that such a person would take their own life, because there were no signs. They didn't see anything. They didn't see it coming. What do we need to look out for, and how do we manage it?
That's a great question. So when we think about mental health, everybody has it, but everybody's different. So the way it's going to look in person A is going to be different than the way it's going to look in person B. And so it's very key to have individuals pay attention to their neighbor, ask if they're fine. A lot of times we hear, "Are you fine?" and they say, "Good." Really dig deep and trying to understand what are the challenges, what are the issues, what is somebody really going through is the first thing that is key. The second thing is that we have to provide services. So Dr. Zainab mentioned the hotline. We need to provide outlets where people can talk, because a lot of times you won't actually notice if there's changes. They may be acting very similar, but if you give them the space and the opportunity to share what's going on in their heart, but through hotlines or through asking or through confidential services, then you can get the information. And the third is just being attentive to your neighbor. If you notice radical changes in behavior, you should ask what's on and offer yourself support. One of the key things that people don't realize is that they are not alone. They think that if they're struggling with depression or postpartum issues or issues of anxiety or stress, many people are actually facing that. There was a recent study that was done by African Polling Institute and MANI, which is the Mentally Aware Nigerian Initiative. It was actually one of the studies that's referenced in the open letter that over 30 CSOs have signed to the President and the National Assembly to pass the National Mental Health Bill. But that study says that about 75% of Nigerians, when you look at small, medium, and high stress, are actually facing medium levels of stress. So we're all in this, we're all challenged, and so we need to make sure that we're all looking after each other and figuring out what the challenges that we're facing.
Yes, and Dr. Sonia, I'm glad that we have you back. So I was asking you earlier, the bill you're pushing, how different is it to the bill that exists currently at the National Assembly that is past second reading at the Senate? Do you want to tell us why we have multiple bills?
We don't have all, but we're all talking about the same bill. We're all talking about the National Mental Health Bill 2020. The legislative history is this. This is a conversation that started back in 2003. And in 2003, the first mental health bill was introduced into the legislative chambers. It wrangled in the Senate for about 6 years. It was withdrawn in 2009. It came back in 2013. Unfortunately, it failed again. And in 2019, we have the bill that we're presently talking about, the National Mental Health Bill. It's gone through the various readings, and it's actually been harmonized by the Senate and the House. Now they just need to take the step of taking that to the National Assembly. That's the step that we haven't happened. And once it goes from the National Assembly to the President to extend its signature. So we understand that people are challenged right now. People are vulnerable. People are more impacted through mental health issues because of the pandemic. And so this is the time for the National Assembly to act in concert. And we actually have, if you check www.nigerianmentalhealth.org, we have a petition that we're asking people to sign. Over 1,000 individuals who support passage of the mental health bill have signed it. It's referenced in our letter again. So ordinary Nigerians can come lend their voices to this important cause.
And I just wanted to ask you, you've both painted how serious an issue this is, yet we do not have an up-to-date law, a legislation for mental health. What does that say about us as a country? And how does this make you feel, Dr. Soye?
I think it's unfortunate. Nigeria is a giant of Africa, but the giant of Africa is facing one of the highest levels of suicide rates. And the World Health Organization in 2016 said that we had the highest in Africa, with over 7 million people who have committed suicide. We have studies studies like the Manny study mentioned that during the pandemic, 23% of individuals are facing anxiety and depression. We have the 15th largest suicide rate in the world. We're the 7th largest in Africa, Nigeria. So we have an issue, we have a problem. These are lost productivity, this is lost lives, and these are our brothers and sisters. And we need to understand that mental health is one of the leading causes of disability. So when we're talking about health, we're talking about mental health as a critical component of it. Just because it's not visible doesn't mean it doesn't impact. So if we really want to revive the economy, if we really want individuals to live their most productive lives, if we really want individuals to be full humans, we have to be talking about not only their physical health, but also their mental health.
Before we let you go, Dr. Zainab,
Yes.
back to the issue of mental health in the workplace. That's a theme for this year. What exactly is it about the workplace, that makes people more susceptible to mental health challenges in your work? What have you been finding out?
In the workplace, that's their daily bread. That is their motivation. They wake up and that is what gives them a drive. That is what gives them motivation. So you wake up in the morning, for example, a married couple, as the husband, you are the breadwinner. You have to get up and have something to do. So you get up in the morning, you have to go to the workplace, you do what you need to do, make sure you make money. If you lose your job, of course, the home front would be very difficult to deal with. If you go in and, with the way the economy is now, the prices of things have gone up, but cost of living has gone up, but salaries haven't gone up. So that is a major impact. You cannot live on one salary to survive. And that is one major issue. And another thing is, for example, the men. I'm speaking on, you go in maybe.
But there are women who are breadwinners too.
No, there are women who are breadwinners, but it's easier for women to talk about their mental health. As a man,
is it?
It is in the society. Because men are more stigmatized when it comes to speaking about mental health. It's easier you see a woman crying, she can carry the weight of her worries on her shoulders or her heart on her sleeve. If a man does it, he's weak. Even amongst his colleagues, he's berated. But for women as well, women having to be breadwinners is harder because it means they have to work 9 to 5 and then go home and take care of the home front. So we need to find that balance. As a workplace, as an employer, I think we need to go beyond that question amongst our colleagues as well. How are you? fine. We need to
and I
probe
wonder how you
beyond
deal
that.
with, you know, colleagues who may be verbally violent, not necessarily physical. How do you deal with such, you know, I mean, colleagues?
Oh, that is something for the HR to definitely deal with. We do not, that's something that should not be acceptable.
And do you have the number for us now?
Yes, I
Please
do.
give it to our viewers.
0800 10 20 30 40.
10, 20,
800
30, 40.
10 20 30 40.
And there you have it, the helpline for you. If
Yes.
you're struggling with anything, you can reach out to the non-governmental organization. Dr. Asonya also has a foundation you can reach out to. But we must thank you both.
Yes, indeed.
Thank
Dr.
you very
Zainab
much.
Mohammed, lead at Reconnect, and Chime Asonya, founder Nigerian Mental Health. Let's give you that number again, 0800 10 20 30 40. Very simple. Thank you so much for joining us.